Good day, everyone. So we will discuss about dermatophytes. So what are dermatophytes? So these are the group of septate fungi occurring worldwide, and they are known to affect the keratinized structures, usually the skin, the most common, hair, nails, claws. There are more than 30 species of dermatophytes recognized, and they are classified usually in three important genera. We have the Microsporum, Trichophyton, and Epidermophyton. So they are septate fungi that are known to invade the skin, hair, and claws. Arthrospores are the known infectious forms. They are associated with skin invasion. So these arthrospores usually remain infective for months when they are in the environment. They are released by fragmentation of hyphae in keratinized structures and may remain infective for many months. So they are known to grow slowly under aerobic conditions on specially formulated media, such as Suborodextrus agar. A temperature of 25 degrees Celsius is usually suitable for culturing most of the members of dermatophytes. Colonies are known to produce pigments. Macrocornelia may be formed in cultures and can cause characteristic skin lesions that is circular. That's why the condition is termed as ringworm. So there are different Microsporum species. So the image here, we have the Microsporum canis, which has a spindle shape. Gypsum is with boat-shaped macroconidium. Microsporum nanum has a characteristic pear shape or ovoid macroconidium. For the Trichophyton species, so we have here a cigar-shaped macroconidium, which is evident for Trichophyton mentagrophytes. And we have Trichophyton verrucosum, which is shown in chains of chlamydospores. Dermatophytes, they are members of the phylum Ascomycota. They have affinity for keratinized structures that are known to colonize and invade the skin, hair, and nails. They grow slowly on specialized formulated lab media, such as the Suborodextrus agar. They are aerobic, tolerate cyclohexamide that is added in the media. Colonies are often pigmented. They form macroconidia in cultures, and as we mentioned, arthrospores are known to be infective for months. They cause ringworm, and we have three groupings of dermatophytes, which are the zoophilic, anthropophilic, and geophilic. The zoophilic and anthropophilic dermatophytes are known to be obligate pathogens, while the geophilic are saprophytes in the soil. So this is a summary showing the dermatophytes of animals. What are the main hosts or their main hosts and the geographical distribution. So we will discuss this in detail in the subsequent slides. So for their habitat, they are grouped on the basis of their host preferences and on their habitat, which are known to be the soil for the geophilic. And then for the zoophilic, they are known to parasitize animal species. And for the anthropophilic, they are affecting humans. So these are the different zoophilic dermatophytes. We have Microsporum canis, Gallinae, Trichophyton equinum, mentagrophytes, and verrucosum. Geophilic group are Microsporum cookie, Gypsum nanum persicular, and Trichophyton simian. Anthropophilic group are Epidermophyton, Flocosum, Audwini, Ferruginum, Rubrum, and Schoenlengum. For the laboratory recognition and differentiation, so they are being differentiated based on their colonial morphology, microscopic appearance of macroconidia, chlamydospores, or other structures, special growth requirements using commercially available trichophyton agar, temperature tolerance test to differentiate trichophyton verrucosum and mentagrophytes, which grow well at 37 degrees Celsius. In vitro hair perforation test, dermatophyte test medium. So we have this trichophyton agar. So we have the control medium, which is the casein basal agar. And we have trichophyton agar T1. It contains thiamine. The T1 is the casein basal agar, and the T3 is the one that contains thiamine and inositol. Sorry for that. T4 is containing only thiamine. For the T5, trichophyton 5, it contains nicotinic acid. Trichophyton verrucosum require thiamine, sometimes inositol. So the media that we can use then is T3 or T4 media. For the trichophyton equinum, it requires nicotinic acid, so that is T5, or it also requires T1. Trichophyton mentagrophytes is known to hydrolyze urea when grown on Christensen urea agar. Diagnostic procedures. There are suitable specimens for laboratory examination. These are plucked hair, deep skin scrapings from edge of the lesion, affected claws, and biopsy material from pseudomycetomas. Microscopic exam of hair, skin scraping treated with potassium hydroxide for the presence of arthrospores, which are the infectious forms. Histological section of skin or pseudomycetomas can be stained by periodic acid shift or methenamine silver technique to demonstrate the fungal structures. So we have the M1 subrhodextrous agar, the identification criteria for isolate. So this table shows the genera that we mentioned that are important. Cause of ringworm or dermatophytosis. We have the trichophyton, which are known to be transmitted human to human or animal to human. Trichophyte, microsporum are transmitted animal to human, soil to human, and human to human. So in humans, usually the one that is strictly affecting humans is the genus Epidermophyton. This is strictly human to human. Natural reservoir, the humans, animal, soil. Infection is facilitated by moist, chapped skin, long infection period followed by localized inflammation and allergic reactions to fungal proteins. So we have different terms of ringworm that affect different parts of the body, which is, this one is applicable in humans. Usually, ringworm of scalp is Tinea capitis, affecting scalp and hair-bearing region of the head, wherein alopecia is evident, hair may be lost. Ringworm of beard, Tinea barbae. Ringworm of body is Tinea corporis. Ringworm of groin is Tinea cruris, or also known as jack itch, affecting the groin and scrotal regions. Ringworm of foot and hand, Tinea pedis and Tinea manium. Ringworm of nails is Tinea unguium. And usually, the treatment of this ringworm infection in humans include topical antifungal agents like tonlaftate, miconazole, applied for several weeks, Lamisil or Giseyofulvin for 1 to 2 years. These are the different images of tinea or ringworm affecting different parts of the body in humans. Tinea pedis, or the athlete's foot infection. This is a dermatophytid reaction that is seen in hands, usually in the hands. Tinea corporis, which is the body ringworm. Tinea cruris, affecting the groin and scrotal regions, or the jack itch that is commonly also known. Tinea cruris again. Tinea unguium, nail infection. This is Tinea capitis affecting the head, the scalp, which is evidently seen as this image, and there are hair loss. This one is known to be gray patch. So for the pathogenesis and pathogenicity, they are known to invade the keratinized structures, affecting the stratum corneum of the epidermis, hair follicles, hair shafts, and feathers. Young, aged, debilitated, and immunosuppressed animals are the most susceptible to infection. Mode of transmission is via direct contact with an infected host or indirectly through infected epithelial debris in the environment. Even minor trauma like gentle rubbing of the skin or through the bites of arthropods. So we will start now with the dermatophytosis affecting dogs and cats, which is mainly caused by Microsporum canis. Although in dogs, there are other dermatophytes agents like gypsum, trichophyton mentagrophytes, and the mentagrophytes variabilis erinacea. So classical ringworm lesions can be seen, biliary dermatitis and pseudomycotomas and onychomycosis. There are evidence of alopecia, scaling, and broken hair surrounded by inflammatory zones. Mostly affected are the young animals, puppies, and kittens. Small circles of alopecia, pale skin scales in center, and develops a crest in the later stage. Most common cause is Microsporum canis. Treatment and control, lime sulfur miconazole shampoo and clipping of the hair coat is advisable. Rhiseofulvin or itraconazole given orally that is used for systemic therapy. Isolation of animals with suspicious lesions. Early laboratory confirmation. Examine in-contact animals using this wood slump. Usually it fluoresces green when it is positive for Microsporum canis. This is used to monitor skin lesions. There are also commercially available culture media that can be used for culturing suspected dermatophytes affecting dogs and cats by getting samples like hair, scales, edge from the lesions, and culture to this commercially available culture media. Vacuum clean contaminated areas, burn contaminated beddings, disinfect grooming equipment with 0.5% sodium hypochlorite. So this one is an early stage of dermatophyte infection that is due to trichophyton mentagrophytes in an adult dog. This is evident in the face area. There are crusting also, and this one is seen in puppy. So this one is an evident dermatophyte infection. Circular lesion with alopecia on that affected part. So this one in cat can be seen in the ears. So usually subclinical, especially in adult cats, but in kittens, they are symptomatic or with clinical signs. There are areas of focal alopecia. Grooming behavior is associated to be the cause of spread of infection. Again, Microsporum canis is the most common agent, self-limiting, especially among short-haired cats. Next, we have dermatophytosis in cattle, which is mainly caused by Trichophyton verrucosum. Calves are the most common affected. Characteristic lesions are seen in the face and around the eyes. Oval areas of affected skin are alopexic with grayish-white crust. So these are the small focal lesion seen in cattle with gray-white crusty dry areas and alopecia. This is also self-limiting. Treatment and control, we have vaccine available now for Trichophyton verrucosum and topical preparation of 5% lime sulfur and Captan 1:300 or natamycin. Next, we have dermatophytosis in horses. Main cause is Trichophyton equinum. We have also less common agent like Microsporum equinum and Trichophyton equinum variabilis autotrophic. Transmission is via direct contact, contaminated harness, or grooming gear. Lesions is limited to girth, strap, or saddle region. Young horses under 4 years of age are the most susceptible. We have Microsporum gypsum that can also cause occasionally, can be acquired from rolling in soil lesions confined to the dorsum, Microsporum canis and mentagrophytes, Trichophyton mentagrophytes, occasionally isolated from horses. Trichophyton verrucosum is acquired from contact with infected cattle. When horses have contact with infected cattle, they can acquire Trichophyton verrucosum. Treatment and control, we have also 5% lime sulfur or natamycin, isolation of affected animals, disinfection of the contaminated harness and grooming gear with 0.5% sodium hypochlorite. We have dermatophytosis in pigs caused by Microsporum nanum. It is not of economic importance, but all ages are susceptible. Lesion may occur anywhere on the body surface as thick brownish crust. This is an image showing Microsporum nanum infection in pigs. These are the lesions. They are spread all over the body. So wrinkled lesions are covered by a thin brown skin, usually easily removes scab, often asymptomatic among adult animals in pigs. And the most common agent is Microsporum nanum. So it resembles sometimes diamond skin lesion, but this one is a light brown lesion, and it is circular in shape. So this is single lesion showing slightly raised light brown lesion of Trichophyton mentagrophytes. Next, we have ringworm in poultry. So this one is also known to be favus, avian ringworm or favus, that is most commonly caused by Microsporum gallinae. Gallinaceous birds are occasionally infected. There are white patchy crust seen in the comb and wattle. If disease is severe, feather follicles may be invaded, and affected birds may show signs of systemic illness. So this is the last dermatophytosis in animal affecting sheep and goats, commonly seen among show lambs. Circular alopexic areas with thick scabs on the head, neck, and face are seen. Widespread lesions under wool, and the most common cause of ringworm or dermatophytosis in sheep and goats is same with cattle. This is Trichophyton, same in cattle, which is Trichophyton verrucosum. And this is usually also self-limiting. So there are also superficial mycoses that are caused by other agents. So we have here caused by Malassezia furfur. We call this as Tinea versicolor, eliciting mild chronic scaling, mottling of skin, also implicated in folliculitis, psoriasis, and seborrheic dermatitis, especially in humans. White pedra is caused by Trichosporum bay jelly. Whitish or colored masses develop, scalp, pubic, or axillary hair. Black pedra is caused by Pedriae hortae, dark brown to black gritty nodules, and mainly seen in the scalp hair, also in humans. So that ends our discussion for superficial mycosis, especially the dermatophytes. Thank you. And if you have questions, feel free to ask them. Thank you.